What are some of the things that you see that you're just like, this is just wrong?
I'll never see with my eye what AI can pick up on an x-ray. If our whole point is get it while it's small, then you should be treating those lesions. Patients trust the AI more than they do us. They are conditioned, and certainly, millennials on down, they're digital natives.
If you're saying, here's what I've diagnosed, and by the way, the computer agrees with me, there's this additional trust and credibility that can take place.
If you don't care about anything else, care about paying back your loans, you will.
Welcome back to the Dental Economist Show. I'm your host, Mike Huffaker. Before we dive in, if you are enjoying the show, please take a moment to like, subscribe, or even better yet, leave a review. Your feedback and support greatly helps us continue to provide insights to dental professionals everywhere. Today, I'm very excited. I am sitting down with someone who has one of the most interesting career trajectories in all of dentistry. From owning a private practice on Nantucket, the faculty at Vanderbilt, to becoming one of the most influential voices on clinical innovation and AI in the DSO world. Dr. Cindy Roark is the SVP and Chief Clinical Officer at Sage Dental, a member of the Harvard School of Dental Medicine Board of Fellows, and a tireless advocate for using technology to genuinely improve patient outcomes, not just as a buzzword, but as measurable clinical reality. Dr. Roark, it is really great to have you on the show today. How are you doing?
I'm awesome, Mike. Thanks for having me. I love this. As I said before, it's the first time you and I have gotten to be face to face, so I'm pretty excited about it.
I am too. Absolutely. Well, thank you for joining. You grew up in Tennessee. You've credited strong women who raised you, graduated dental school, magna cum laude, and eventually ended up practicing on Nantucket, of all places. Before we get into the DSO world, I'm super interested in talking about kind of your views on clinical technology and advancements. I'd love to understand a little bit more about the person who was Cindy Roark before she became an executive. And what did running your own practice teach you that you still rely on today?
Now, that is a great and very broad question.
It is.
What
So you go a lot of different ways with this one.
I know. I'm like, who am I, right? Who I am is what I do mostly, but really, it's interesting because it does go back to family. My grandfather is super influential in my life, and one of the things he said early on, because of course I'm young and I grew up with really limited means, and he asked me when I'm like 9 or 10, what is it you want to be? And I'm like, I just want to make a lot of money. And he's like, no, 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 no. He's like, you want to make a difference, you were here at all. Right. And that stuck with me all these years. And I'm not kidding. He passed away shortly after that. But it is an important thing because when you're young, I think, our generation was kind of taught like you just work really hard and you make money, but that is not the be all end all. And the older you get, you realize that's very little. If you can't make a difference, bend the curve on decay, any of those things, if I can't make this career or this industry better than I found it, I'm kind of wasting my time, if that makes sense.
No,
So that's me, actually.
Yeah. It's recognizing that that's where you really find the fulfillment in what you do,
Right.
rather
Right.
than just the financial, which can feel very, very empty at times for people. But it's a good reframing of what's really important. I think most people end up going from C-suite to academia, and not the other way around. But you went back to Harvard for your master's in healthcare management while you were already mid-career. What prompted that change, and how did you think after that experience?
So what was interesting about that, it really was transformative and life-changing and all the buzzwords people say, but I mean that it was. What made me go and seek that type of learning is I got asked to be a kind of a dental director for a previous DSO. And when I sat in the C-suite chair for the first time, it was really humbling because you realize, okay, I am the subject matter expert on dentistry here, but every person at this table knows more about the business side than I do, right? And that's just not a feeling. For someone in a dental practice, the buck stops with you every day, every time. And so I'm walking in this room where, yes, it's about dentistry, but it's the business of dentistry. No money, no mission. It's not evil. What they do is not evil, right?
Yeah.
But you have to know it. And I felt a gap in my knowledge. We don't get that in dental school. I mean, you might even get an hour of practice management. Okay, it's just not there. And so I thought, well, let me figure this out. So I applied to the program. Of course, grew up in Tennessee. I'm sure I had like imposter syndrome when I walked in there. But walking out of there, I felt ready to take on the world. I felt entrepreneurial. I felt, figure the projects you want to do because now you have the tools to make them work. And so it was transformative in terms of what I do. I didn't walk into this role saying, I'm just going to be chief of police, right? Which is what clinical officers are, frankly, at most DSOs. I wanted to drive revenue, but for the benefit of the patient. What can I bring in at scale that actually will move the needle on dentistry? And that kind of goes into my whole granddad thing, right? Realistically, I can do one thing at a practice, but being able to do it at scale and possibly move the whole industry, that's a big whopping deal.
Yeah, absolutely. So this actually is a great segue into my next question. And chief clinical officer or chief dental officer at a DSO, and I've spoken to quite a few, is a role that maybe can mean very different things depending on the organization. And at Sage, with I think you're 130 plus, 140 plus practices.
146 today. We opened Farragut yesterday.
Today. Congratulations. Yeah. Awesome.
Thanks.
And it's been incredible to watch the growth. I'd be curious, what does the job for you actually look like on a daily basis? And where do you spend your time that maybe people would find surprising?
Actually, I can answer that easily. Here's the thing. When I first got hired at this particular DSO, I think the expectation from the board was she will be out kind of trotting office to office and telling people what they're doing right, effective immediately, what you're not, those kinds of things. And really a police officer.
Yep.
That had been their experience in the past. Well, they had a new CEO, Tom Marler. I've worked with him 3 different DSOs, and he's a rock star and pretty entrepreneurial. And he knew what he was getting, right, when he pulled me over. And I credit him with having the board take a step back and say, just wait and see, what will happen is a little bit different. And so when you say, what is the job? Well, my job now is the compliance piece, because it's very important, but that's probably 25% of the job. 25% of the job is scanning constantly. What is new? What is out there? What's ready for prime time? And what really will bend the curve on health, right? Innovation. I'm really fired up about innovation, but not just to have the shiniest new toy, but what can actually help patients best, right? Yeah. And so that's 25% of the job, playing around with those. 25% is probably me piloting, and I might pilot 11 different things in a year, and 3 look like they'd really accrue to the benefit of the patient, the doctor, and the organization. And not all things will fit in those 3. And they may be wonderful, but maybe not for a DSO or whatever. But I'll take 3. And then the final 25% is, how do we scale it? How do we roll it out? How do I get pull through? It's kind of a figure 8. If you quit focusing, they quit doing, right? And so I would put my job into those kinds of buckets. At the end of the day, I really do consider myself a business partner, but not for the sake of money, for the sake of, let's really make this different. Let's do it better,
I love that. Becoming a business partner that creates better outcomes for the patients. And I definitely want to get into kind of what you're seeing from a technology perspective in a few minutes. And I know you've got your finger on the pulse of a lot of different things that are happening in the industry, and things are changing quickly. But before we get to that, I'm curious how you navigate. You made the comment, which I laughed a little bit, where you were like, it's not a effective today sort of scenario, which I think is what happens in a lot of cases, which creates this friction between support leadership and individual practices oftentimes. And you clearly have to navigate the tension that exists in every DSO between the clinical autonomy, which is, I know it's not a buzzword, but it's certainly thrown around a lot in a lot of different meanings, balanced with operational consistency and accountability. And so I'd be curious your approach to building clinical protocols or integrating new systems or solutions that protect the quality while also making sure that the clinicians and the doctors themselves in the practices, don't feel like they're being turned into an assembly line worker or losing, what they originally got into dentistry to achieve.
Right. That's kind of a two-parter. All right. Number one, how do I do it? Is I genuinely look at if I found something that I think is groundbreaking and amazing, and we've done the economics and it makes sense for everyone. I consider my role a sales job. It is a major sales job. I have to make those doctors want to do it because I was that doctor who had things pushed down to me. And I was like, I'm not using that. That's like a New Year's Eve glow stick. That doesn't tell me anything. Right. So it's got to pass my BS meter, if I'm allowed to say that. Um, Everyone thinks their product or service or technology is groundbreaking, and some are, and a lot are not. Right. And so for me, cutting through all the chaff and figuring out what really is innovative and amazing, and if it really is, then my job is to sell it. My job is to get you to understand how this is going to make your life better as a doctor, right? And I very much have to target that and have to do it constantly, because if they don't want to do it, they will not do it. Period. They'll move on. I've got a whole new problem and a whole new doctor to try to get on board. And so it has to make sense. It has to pass the sniff test, and I have to sell it. So that's the how. Get out in front of it and really sell it. I do partner with the vendors a lot. I think that's important. But it can't be all one and it can't be all me, because external, they may not have the internal validity with the teams. And if it's just me, they think the man wants to make more money. Right. And that's not it at all. That's not where I'm coming from, but I have to get them to understand that. So that's really the how on that. And I actually have to touch base on something. This will be weird and controversial, but yes, everybody throws around autonomy, right? Every dentist that I hire thinks they are an A+ performer and amazing. And I've even had people just recently say, you know what, my actual wet impressions are better than a scan. Okay, statistically, it's impossible. You're not. And so when we talk about autonomy, I think it's important, but where is conventional medicine going? It's going, if you have diabetes in Seattle, you're going to be treated the same way you are in Miami, because we use EMRs and there are standards. And if your blood's hitting this level, you're going to get X or Y or Z. And what conventional medicine is doing is actually taking that variability out of it. Right? I don't want cowboys who are using an herb over here versus somebody using like a 50-pound hammer over here, right? You need to be able to what statistically works and what should we do, which really ties into the point about AI. I got a ton of pushback. We brought in some computer annotated x-rays, a couple different companies, and I love them. I'm big fans of everybody. So it isn't about one or the other, but we brought it in actually 6 years ago when it first came out. And I was like, this is amazing, right? This is killer, because the human eye will see 64 megapixels, somewhere in there. And it sees 64,000. Okay. I'm off on my numbers a bit, but you get the scale, right? I'll never see with my eye what AI can pick up on an x-ray. And if our whole point is get it while it's small, then you should be treating those lesions. And I'm not saying drilling. You can now use Ceuridon or whatever you want to heal it. But getting something when it's small is just obvious to me. So then I take this thing that is incredible and useful and scalable and consistent across the entire organization. Why wouldn't you want that? Right. Well, I've got a bunch of dentists who are used to looking at an x-ray, and maybe they're my age or older and they can't see like they used to. There's a lot of that, and the variability is all over the map, and it doesn't make sense for the patient. They should be able to at least know. I mean, if you want to keep your autonomy in terms of what you do about it, that's great, right? But there shouldn't be this variability where one dentist says you have 7 cavities and one says you have none. That should not exist, or else we're just quacks. So that's where I come from, convincing dentists of that. I've got to go science and hard and blow up x-rays to the nth degree. Do you see the lesion now? Bigger than my house. I hope you see it, right? So that's really the thought process on that.
I appreciate the sales is not a dirty word. And as a sales guy myself, in our company, I'm often telling people, I was like, you realize we're all sales. Yes. Whether or not you're trying to get buy-in within one department to another department, or within your team or people that you lead, it's a skill that is to help solve issues, solve problems, and
Mhm.
get that buy-in that's can sometimes be challenging. With the AI piece, going back to you being a very early adopter in that technology 6 years ago, what have been the most meaningful changes there? Let's just stay on the radiographic AI portion of it. Every couple months we see all the press releases from all the various companies. Going beyond just the standard of care piece of it that I think is incredibly important. Are there other things that have come out that seem to be extra beneficial to clinicians and to patient outcomes?
Yes, I actually think we're at a tipping point. And again, I get no money from any of these people, so don't have that thought. We're at a tipping point with that because as companies move to different practice management platforms, and within Sage, we're actually migrating to Denticon, and that you might think, well, that's no big deal, but it actually is a very big deal because in the past we've had to go out to different systems to pull in the AI annotated radiographs. So one piece of going to a new PMS is suddenly we're going to be able to view it in one system. So anytime I dumb it down, simplify it, take the friction away, my teams will use it at a higher degree. And that's what I want. I want to drive utilization, but not just on the AI radiograph side. Now what we're seeing is if in fact insurance carriers are also using the same thing, we're very, very close, if not there, to the point of auto adjudication. Now, I do not know a single dentist in this entire country who's like, I love doing claims and mailing it out,
Me
hoping
neither.
they'll pay. Right?
Yeah.
It's a time suck, and it's really stressful to do work and wonder if you're going to get paid. So, as we move toward this company is using the same AI you're using, yes, we all agree a crown needs to be done here, or we're going to downgrade to a filling. I can at least let my patient know this is what they're going to cover. This is what I think you need. Do what you want. I just think that changes everything. It makes the job easier. The stress goes down. Being able to use AI for components such as eligibility and what have you actually used, also a big deal. They just make life easier. And so that's what I love about it. Our jobs have gotten very complex in a hurry, and patients don't love that.
Yeah. Do the clinicians have an appreciation for the part of leveraging imaging AI that is increasing and building trust with the patient and additional credibility? Like when I view it, obviously I can't see anything on a regular X-ray. I have no idea what I'm looking at. I
Right.
think it's super cool. My dentist does not use AI. I've mentioned this a million times on this podcast. I'm gonna have to
The
like
nerve.
I know, but I really want him to because I want to
Right.
see my X-rays with the AI
Mm-hmm.
on it. And from
Mm-hmm.
my perspective, as a technologist and somebody that loves technology, which I think there's many others like me out there, if you're saying, here's what I've diagnosed, and by the way, the computer agrees with me, there's this additional trust and credibility that can take place. And sometimes I feel like that piece is like missed, like the forest through the trees piece with a dentist who is viewing it maybe from an ego perspective rather than from an opportunity just to practice the best dentistry possible.
You are spot on about that. And that's actually one of the pieces when I said I have to sell the facts. Because what's interesting is depending on the study, it's all over the map. I've seen some that say 78%, some will go all the way up to 90 something. But patients trust the AI more than they do us. And I think that's an obvious thing because they'll trust, a remedy on TikTok more than anything I
It's
say. Right.
unfortunately, yes.
So they are conditioned, and certainly, millennials on down, they're digital natives. And so they see this, they see a tooth, and this bright pink jumps out at them. And I'll go to the color too. The human eye does not, certainly if you haven't been to dental school, grayscale means nothing. So if I show you this x-ray and say, do you see that? They'll shake their head, but they don't see it. They're not taught to. And your eye doesn't read grayscale unless you've been taught. And so for a patient to be able to see the bright pink and you're like, well, here's your nerve, it's like sitting on it, that's a big deal to
Yeah.
them. And so I have to get out to my doctors like they trust this stuff. If I can get nothing more out of you, do it because you'll make more money.
Yeah.
Right? I mean, that's
Right.
not what I'm trying to sell it with, but at the end of the day, if you don't care about anything else, care about paying back your loans, you will. They trust it. So just let the science guide you.
Before we get into the future, what are some of the other innovations over the past 3 to 5 years that you've seen start to gain wider adoption clinically, better buy-in from dentists and doctors and their teams, that you've leveraged and still are viewing as favorable things to kind of move into the future with as well?
So I've got a couple right now that I'm really have a crush on. And one of them is, and these are, again, I don't bring up brands for a reason of bringing up brands. It's just how I refer to them.
Yeah.
So we're implementing Midas. And what's funny about that is it's a 3D printer. And I have been
Mhm.
following 3D printers for 20 years, right? And every time I would go to a show, I'd be like, amazing technology. No one's going to adopt this. Amazing, not going to do it. Amazing,
Yeah.
it's too expensive. It's too hard. I didn't want to be a lab tech, right? I've got 1,000 reasons every time, but they're amazing technology. And suddenly, what's funny is at IDS last March, Midas came out. It was the belle of the ball. It was everywhere. Everyone was going nuts on it. And I had gotten the opportunity to see it before it came out. And when I looked at it, I thought, you know what? 5 years, this thing's going to change everything. And here's why. It's actually, if you can do a Keurig, right? If you can make a pot of coffee, you can print a crown, right?
Right.
So you've got a pod and you scan it, and AI helps you design this crown based on all the crowns that have been done in all the labs and all the time, right? And it pops it out in 10 minutes. I mean, a crown coming to you that can be cemented in the mouth in 10 minutes, that you didn't have to design, you didn't have to stain and glaze, you didn't have to post process this way. I mean, that really is a game changer. And it's not just the science. If you think about, since COVID, expenses have gone through the roof in a dental practice, whether it's private, DSO, doesn't matter. Cost of DAs, cost of hygienists, labor, supplies, it's up, 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 and it's not going down anytime soon. So if you think about what lever could any dentist, be it DSO or private practice, what levers can they even pull? And bending their curve on their lab bill is one of those levers. So suddenly, if machines used to cost $70,000, $80,000.
Right.
Now I've got less than 10 grand all in for this chairside thing that's the size of a Keurig, and I can print in house. Done.
Yeah.
Game changer. But what's funny is the amount of time it takes to change behavior,
Right.
right?
Right.
So when I launch it, again, I've got to sell it, right? And it cracks me up because I'm like, this benefits you. Like, at the end of the day, I'm surprised I have to sell it to you, but that's the way it works. And I think that those kinds of things, once they hit sort of that escape velocity, I think that will be the way it is done pretty much everywhere. The same way a ceramic crown really stepped in and knocked that PFM that had been king for 100 years. I see it doing something like that. I really do.
That is it. What is the material that it prints it out of, and does it have a different feel in the mouth or anything for the patient themselves?
Well, yes and no. So the material itself is a ceramic composite. And so
Okay.
early on with doctors, everyone got so enamored with that ceramic crown. I can even remember the ads where they would have a crown and on wood, and they would hit it with a hammer and it wouldn't break. It'd go through
Right.
the wood. And they're like, oh, indestructible. Okay, great. That will wear the heck out of opposing teeth because your other tooth is not indestructible, right?
Mm-hmm.
So it can actually usher in something very bad. It is not close to, let's say, the modulus of elasticity of your dentin or your enamel. So better, right? Great, great product, good use, bruxers all day long, but you need something more biocompatible with what your tissue actually is. And so what I love about the product, and again, I have to educate on it all day long, you don't want it so hard that I can drill it through wood. You don't. You need something that flexes a little bit because your mouth does. You need something that is very strong, but also elastic to live long term in the mouth. And so it actually is a more biocompatible product than that all porcelain ever was. So the same thing that doctors use as it's soft, or it's not soft, but you understand where I'm coming
Yeah.
from. If they're
Absolutely.
like, it's not as hard as that, I'm like, you don't want it to be,
Yeah.
right?
Yeah, the education piece becomes really important. Are there other applications with 3D printers? Can you do like dentures or like something larger than a crown? Kind of where does
Yes.
this go, and what are the additional use cases?
So I see actually, there's 3D printers, that whole like the bigger ones that you can do anything, can make hybrid dentures, you can do all that. That isn't quite the same as the Midas. It's a fluid press dynamic and completely different from any other type of
Okay, yeah,
printer. And so it does change what you can do, doesn't limit it exactly. What they're doing now is making a bigger build plate, and that means you'll be able to do bridges too, because
mm,
right now what it does and does best would be single unit crowns and veneers. And talk about game changer. Now again, we can all argue whether veneers are a necessity in life, right?
sure,
But they're really hard to do given the temp phase, because they just don't have anything to hold on. You need to get them off. It's just a nightmare. When I used to do veneers back in the day, they're popping off constantly. It's just a nightmare. So imagine if you can get the smile figured out on the front end with AI, and they walk in and they walk out with veneers that day. What? I mean,
yeah.
crazy. And if they don't love it, you reprint one, right? The whole risk, it just de-risks it all. And so I see it going from more single unit crown and veneer to larger span bridges and things like that. They'll work with that build plate, and they're being, I think, very responsible and a little bit conservative with bringing these things out, because I've seen prototypes and they're amazing, but they're really taking their time and want to make sure they've got the product people need. So
Yeah. So as we look on the horizon, what are some of the things that you're excited about now? And what do you think is kind of reality versus some promises? Like I just saw last week when I was at Chicago Midwinter, I went to a conference and there was almost like a Shark Tank style investment pitch program, which was
mhm.
really cool to watch. And one of the gentlemen that was up there is launching a hygiene robot, basically. Very, very early stage. Like they're
Uh-huh.
still testing on models and doing things like that. And they need
Sure.
a huge amount of funding to make that a reality at some point. But when
Right.
you're looking at the landscape, and there's so much out there, what are some of the things that you think are real, like real and available or soon to be available, that will be game changers for the industry?
Absolutely. So a couple come to mind. One, it's still in its final ADA. I'm sorry, FDA. ADA, FDA pitch, but wisdom tooth ablation. There's a company called Triogenics, and again, no affiliation with me whatsoever. They are in final trials. It takes 30 seconds for them to use radiofrequency ablation or microablation to ablate a wisdom tooth bud. Now, to me, having the ability to bypass that for wisdom tooth surgery and the trauma and dry sockets and nerve damage and, gateway to drugs, frankly,
Yeah.
number one gateway to opioid use, being able to ablate those so children never have to go through that surgery, to me, what a benefit to society. So that's one that it can't get cleared fast enough. I will be implementing that the day it comes out.
And real quick, for those that don't speak fluent
Sorry.
dental, can you
Yes.
explain ablation and kind of what that process looks like, how it compares to the traditional surgery
Sure.
that people have been going through for wisdom teeth for forever?
Forever. Yeah, absolutely. Thanks. Wisdom teeth, as they're pulled today, depending on how your teeth come in, it's actually a pretty rough surgery because it's done at age 18, typically when those teeth have erupted or have not had the ability to erupt. So basically, you're 18, you're finished growing, and they are anchored in there, right? They're not going anywhere unless you get them out. And it's a rough surgery, as we all know, those of us who've been through it. Now, what is ablation? It's done between ages of 6 and 12 when a patient actually gets that bud forming. So it's a little circle, it's a bud. We don't have roots yet. And, that's what will go on to grow the tooth. So if we get a CBCT scan and we make a little, basically the equivalent of a night guard with a little hole in it,
Yeah.
it knows precisely from the CBCT where the bud is. So there's a hole in it, and you literally use topical. You'll do a light anesthetic, but a very light anesthetic, and in 30 seconds with radio frequency ablation going directly to the bud, it's obliterated. It does not form, doesn't form at all.
Yeah.
And what a gift! 30 seconds per tooth. with
That's
something that
incredible.
barely hurts. I mean, it doesn't hurt at all. I'm talking the shot itself, and
Yeah,
that doesn't have to be a full nerve block. It's literally infiltration. I can't. I would have loved it at my age or for my daughter.
absolutely. No, that's incredible technology. What else are you seeing out there that has kind of caught your eye?
So there's something I'm loving on the braces front, and I think this is kind of interesting. You know, we've had traditionally band and brackets, right? Everybody
Mhm.
knows what it is, mouthful of metal, it is what it is. And then you have aligners, and aligners are amazing and all these things. But there's that middle category. Okay, you cannot convince an orthodontist who's been doing traditional braces and brackets for years and years and years, you cannot convince them that an aligner will do the same thing. And to be fair, it will, but it's going to take a lot of time,
Yeah.
right? It's not as predictable, it's completely different. And so to me, I look at it and I think, okay, one is archaic. We just move the teeth back and forward and back. And there's no science. You're just adding force and good luck. Let's see where it goes. And next month we'll see again where it went. Not great, right? Not great at all, but you know, it'll work. And then you've got your aligners, beautiful, pretty. They overextend all the time. You have to retreat all the time. I'm trying to think metrics wise. They average 2.4 refinements and they average months and months of overtreat and retreat and those kinds of things, and almost never really fulfill the promise of getting where they're supposed to be unless you're simply doing the social six. Okay. So it's ripe for innovation. I've seen a lot of different innovations, but probably the one for me that I like the best is something called Brava Plus. And Brava is fascinating to me because it's lingual on upper and lower. And yes, lingual's been tried before to limited success. But what I like it, the reason I like it the most is the science is completely different. It has these independent moving bars that go to each tooth. So that means theoretically you could turn each tooth 360 degrees if you wanted to in a very short amount of time because you're not depending on the whole arch to pull forward or back. Each tooth is moving independently. So it moves at warp speed.
Yeah.
Warp speed. So you can get a case that would have taken 36 months done in 10, right? And you didn't move it back and forth 50 times. You just simply guided it into where it needed to go. It, to me, is groundbreaking. Now, what's interesting about it is it's taken off in Japan like hotcakes. Do it all the time. Science is there, studies are there, these massive cases that you just can't even believe. And it's taken its time in the US. And so I'm not sure I get that. But I expect that as a middle hybrid to be something that I would have wanted as a patient, and I think it probably should be used more than it is.
No, that's really interesting. What are some of the things that you see that you're just like, this is just wrong? Like this is false. This is fake. Like it's not actually going to work out the way that it's being billed as. There's
Yes.
a lot of noise out there. So what are some things to watch out for?
Okay, so one that keeps coming through my Instagram feed, because obviously my Insta is heavily dental, right?
Yes, yes.
And I keep getting this one, and it is the coolest Marcom I've ever seen. You know, very high tech with these fibers coming out of the teeth, and it's a Korean patch that will regrow teeth in 20 minutes a day in about 2 months, right? So it's going to
Okay.
put to bed dentures and implants and all these big
Yes.
things, right? Amazing. Regenerate your teeth, right? Absolutely no science behind this Korean product whatsoever. Because I hunted it down because I'm like, oh yeah, this is all me. We're getting this patch. There is no patch. It's
Yeah.
not even real. There's no science behind it. But what I do think is 5 to 10 years regenerative dentistry is getting play, but where I'm seeing it would be coming out of like King's College in London is using something that was used for Alzheimer's that actually has some sort of regenerative capacity. They're trying to make that work from a tooth standpoint. There are some groups in Japan working pretty heavily on it too, but nobody's there. This is not ready for prime time, and it certainly isn't coming in 2026, as the Instagram feed will tell you. That I think is fascinating.
So the recommendation is do your homework. Don't trust
Yes,
everything that you see online. Certainly not fed likely through Instagram or TikTok or some of the other
right,
social media vehicles.
right.
You made a couple comments in our conversation about what is being done on the medical side. The industry, I think for a long time is, kind of talks about oral systemic health, which we know is
Mhm.
important, and also about the integration of medicine and dentistry. Is that happening in any meaningful way at the practice level, or is it still, predominantly a dental conference talking point?
So in reality, I think it has not achieved the potential it should. Right? It's a talking point and it's a great one, but we're siloed in the sense that there's a carrier, there's a doctor, there's medicine. The two never meet, never talk. And for me, I'll tell you, there's something that we are piloting, and I don't know where it's going to go. But one of the things we're piloting is working with an insurance carrier, and that carrier will share with us. And I mean, they'll have the approval of the patient, obviously. But anytime we see somebody who has cardiovascular disease, diabetes, any of these things, if they're on any medications like antihypertensives, right? How many people in the US are on antihypertensives, antidepressants? Those things cause a decrease in saliva. What does decrease in saliva do? Increase decay and bacteria, decay, gum disease. So we now can work with them and build a reciprocal thing, sending them, okay, hey, if you're on these things, you might want to think about getting into the dentist. That's really I think the entry point. If we can get people to understand, because you're not thinking like I take an antihypertensive, never thought like, okay, it's not inevitable that these teeth go downhill just because I'm aging. It's inevitable because the saliva is going down. So let's fix that. And so I see it as a very slow process because the universes are really siloed. But once you can build the curve and sort of get that education going one way and together, I think you can do something with it. I'm really excited about that
Yeah.
because that's really, again, that whole making a difference. Well, I would like somebody to actually treat something if they have a medical problem, but I'm not allowed to see that at this point.
Right,
So,
right. So a lot of people talk about the kind of status of new dentists, new doctors coming right out of dental school, and like where they're at and how prepared they are to enter into a practice or open their own or whichever path they end up kind of choosing to pursue. If you had to identify the biggest gap between what dental schools are producing and what modern DSOs actually need from clinicians that are entering the workforce, what would you say that is?
the biggest gap for me is not in any way the new dentist's fault. You maybe did 8 to 10 crowns the whole time you were in dental school. Spend
Mm-hmm.
2 years on fillings, 8 to 10 crowns. We have an aging population who, by and large, will have old things breaking down, not need new things. So we spend all this time teaching how to do the best filling on the planet and very little time on the reconstruction that actually matters and you will be doing. And you see 3 patients a day max before you graduate, right? And then we put you in the real world and it's, 12 patients a day. You can't do any work. You can barely even get through the patient's exam at that point. So when I think about what I would like to see would be a holistic model from day one. You've got to learn the science, but you don't need to sit in a lab and learn how to do amalgams or composites for 2 straight years and then walk out and do anything but. I think we aren't ready for the full patient, and I think that has got to be addressed. They're just not ready. We spend a lot of time. When I was in school, we still had to learn how to like pack your own dentures. We have a very long course.
Yeah,
Nobody does that.
yeah,
So you need to know certain things, but to be able to effectively treat a patient, you need time on task and you need psychomotor skills with your hands. You can't just learn that. You have to do that. So if I've only done 8 to 10 crowns and I got released onto the public, it's bad.
yeah.
You know, it's not fair to the patient. It's not fair to the
Right,
doctor.
right. No, it makes a lot of sense. We're going to be releasing our latest industry report pretty soon. And we talk about a lot of data points in that, including kind of year over year growth, case acceptance, new patient trends that we see. And one of the things that I thought was interesting is that one of the strongest indicators of growth across all the practices that we serve is the amount of new patients they see. And I know there's a lot of conversation related to, well, you have everything that you need in a practice as long as you have strong patient retention, you're not losing the patients out the back door. And I had this thought, and I'm curious if to pressure test it with, you can sanity check me. But
Okay.
for myself, as a longtime dental patient at the dental practice that I go, the value that I provide from a production perspective is relatively low. I go twice a year. I don't have cavities. I don't need crowns. I get my hygiene appointments and my cleanings, and like there's not a lot of increase. There's no unplanned treatment plans that like they're trying to get me to do. None of that.
Right.
But I know that there's still such a large percentage of the population that doesn't go to a dentist, and so my thought was that the average value for a new patient is likely significantly higher than what
Yes.
you get from a long-term patient, because when you're having a patient that's consistently treated, they're likely to have less dental problems that would result in a higher production. Whereas folks that are new to the practice, you're likely treating, chipped teeth and needs for crowns and root canals and things along that. Am I thinking about this in the right way? Is that
Yes.
an accurate
You
kind of
are.
representation?
100%. You're always going to need the new influx of patients because there are a finite number of teeth. You're right on the money with that. And, and honestly, the economy is a little rough right now for people. And I think new patients have taken a little bit of a dip at most practices, not DSO specific, but at most practices, new patients are down. And you start to see that shift in times. I saw it in 07, 08 too, where it's not that people stop coming. They come for different things, because prior to 07, 08, people were getting ear-to-ear veneers constantly, right?
Right.
Money was free and credit was free.
Sure.
Oh, yeah. And then immediately after that, people still came, but it was like this tooth broke. Far less emphasis on cosmetics than it had been in the past. And so I look at us right now and we see more triage and trauma type. This actually hurts versus, hey, I don't like how I look. We see a lot more of that, but absolutely, you will die as a practice if you don't have a way to attract new patients. And that just is what that is. It's a game of attrition.
Yeah. Well, on a lighter note, and as we wrap here, so
Yeah.
you've got SEC football loyalties, startup
Yes.
investing, teen mentorship. It's a pretty interesting combination of hobbies for a dental chief clinical officer. Is there
Right.
one of those that your colleagues would maybe be most surprised to know that you're passionate about?
Well, I'm pretty out there with my SEC and college football love.
Yeah.
I mean, I don't think anybody's surprised. I think I kind of am what I am, and I don't hide or pretend to be something I'm not. And so I don't think anybody'd be surprised about any of it.
Awesome. Cindy, thank you so much for joining. You're a great follow on LinkedIn as well. So for anybody that is not currently following Cindy, please do. Is there anywhere else that people can find you?
I am mainly sticking to LinkedIn at this
Okay, me
point.
too. Same.
Yeah.
All right.
My Instagram has maybe 27 people, and I'm related to all of them because, and I say that as a funny thing, but I just don't want like the spin in the news. It wears me out. Dentists and people in any kind of medical field, we have to treat everyone across the spectrum. And I don't want to hate my grandma, and I don't.
Yes.
know.
That's fair. That's a good approach. I
Yeah.
never log in anymore unless somebody sends me something to click on. But I had a friend that was like, "You never look at any of the things I send." I was like, "You haven't sent me anything." He goes, "I send it through the app," and I was like, "Yeah, that requires me to open it." So
Never happening.
it's got to be separate and apart if you want me to actually like put eyes on it. And then I
Right.
have to be very cautious about what's clicked on because it turns your whole entire algorithm into something else.
Yes.
It's you got to watch out for social media these days.
You
might
do. And
be buying patches to regrow teeth.
Exactly. That's what you get. And my stuff's all discoverable in court. So I'm like, I just got to keep it separate. But anyway, what a pleasure. I really have enjoyed this.
Yeah, absolutely. It was great to finally meet. I look forward to seeing you this weekend at the Denobi Awards.
Absolutely. I'll see you then.
All right. Take care.
Thank you. Bye.
The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.